Welcome back. Coming up with a skincare routine that's right for you is really important, especially as we head toward the summer and we're exposed to more of those sunny days. Dr. Stephen Lewellis is a board-certified dermatologist and owner of Above and Beyond Dermatology. He joins us live in the studio now to talk about how you can craft a skincare routine that's right for you, but there's a lot of factors that go into that. What do we need to consider?
Thanks for having me, Hannah. The most important thing to consider is something that you're going to use consistently. That's what I tell all my patients. Just like brushing our teeth, it doesn't matter nearly as much what toothbrush, what toothpaste, compared to using it every day without fail. And just like brushing our teeth, your skin is going to look way better over time if you stick to that. Yeah,
and you have a simple step routine that you can go over. Tell us how to give us some direction.
Yeah, I try to use frameworks for teaching my patients, make it easy to remember for them. Because again, we want to make this a habit, make it easy to do. So I teach my script framework. I like that because it recalls a prescription or a script you're following. SCR in script is what I want people to remember. So S is for sunscreen. It's always the most important thing because the sun ages our skin. It increases the risk of skin cancer, especially people with fair skin like me. We need it the most, but everybody benefits from sunscreen. C is a vitamin C serum. Something in the morning with vitamin C helps because it's an antioxidant. That helps against pollutants in the environment. And R is a retinoid. It's a little more complicated, but great for anti-aging. That's something you apply at night.
Okay, awesome. Are there any ingredients that we should maybe stray away from or avoid?
This comes up with sunscreen a lot. So people often ask about chemicals in sunscreen that may hurt coral reefs or things like that. The evidence is still mixed, but people who are worried about that look for what are called mineral or physical sunscreens. These are typically just titanium dioxide or zinc oxide, and sometimes iron oxide as a tint as well. That makes it easier if you're worried about sunscreen chemicals.
Okay, and those are the kinds of things you'd see like on the label.
Totally. I have one right here actually, and it's from Eucerin. It says sensitive mineral face, and this one does have a tint. This is just zinc oxide, but it's tinted as well, so it blends in with many more shades of skin.
Okay.
Mineral or physical is the word you're looking for.
On the flip side, are there any things that are like must-have that you should be looking for in the label?
Oftentimes non-comedogenic you might see on the label if you are acne prone, for instance, because comedones are the first part of acne. So if you're worried about that, look for non-comedogenic. But it's really the SPF 35 or 30 as a rule for sunscreen. At least 30 is good as well.
Okay, got it. And obviously everybody has their own varying needs and so many unique situations. But you have a guide on how to help people out with that?
Yeah, of the things I talked about today, topical retinoids are the biggest problem that people have, but they are also so much to gain because they help with acne, pigmentation, and fine lines and wrinkles over time. The one I use here is called tretinoin 0.1%. That's a prescription, but you can also get them over the counter, such as a Dapoline gel. And I have a guide that walks you all the way through that because it's super complicated at first because it can be a little bit drying or irritating.
Okay, awesome. And so we have a link to your guide on our website, WSAW.com. So if you really want to learn about this, we will help you out. So thank you so much for joining us.
You're very welcome. Thank you for having me, Hannah.
And you guys